We're going to actually have a chance to hear what all the other groups have to say. Okay, that's right. You going to sit in? Okay. All right. So my name is Eve Higginbotham. You've met Steve, and we look forward to hearing from our lead facilitator. So we'll start with Dr. Ann Coleman. Did you want to say anything more?
No, that's good. I'm not Ed Marshall. Ed had to catch a plane before he got snowed in. So apologies for that. But we're in good hands with Eve. So.
Well, thank you. And Ann, your group was surveillance and research. So what are our action items going forward?
We have a lot. So for our group, we had a lot of great discussion. And so I thank all of the group members that are here and those that are not. But one of the first things we felt in terms of the research agenda that it was really important to define our terminology, and the recommendation 4 that was put out by NASEM was very broad. It really covered all types of research, going from basic science to health services research, clinical research, translational research, and public health research. But the group talked about it and felt that it really needed to be somewhat focused at first. And this was because in recommendation 4, it was recommended for the HHS to pull together an interagency work group. And so we had a lot of discussions about that, but that we would want it to be focused so that then we can move forward with some action items. We thought that it was important to contact and engage all stakeholders and to really break down the silos. That one of the things that you have with research is that you have individuals or different groups doing different types of research, and we really want to be cross-cutting and cross the whole landscape. One of the big questions is who's going to lead this initiative? There's a lot of things going on in DC right now, and would it really be HHS? We still think so. And so the issue is that we felt that you really need to have human health and services really engaged in the process, or you're really not going to have the impact that you want. One of the things that we did talk about also with the research agenda was to move the research upstream and to really look at equity and access, health literacy, and more population health data needed. Suggestion about doing practice-based research, which also could tie into this, and also to try to leverage existing networks across the country. We recommended developing about 3 to 4 research priorities, really looking at that low-hanging fruit. And so one of the things that we felt that could be done that was low-hanging fruit that the CDC is already doing somewhat, especially like with the NORC project, is to strategically leverage existing databases. And in terms of other work, we were looking at the role of possibly having private philanthropy to help pull together these work groups. But as I mentioned, that we felt it was very important to have HHS involved so that they would be accountable in convening the group and accountable in any action items that were found. In terms of what we felt that was needed is we needed strong public health systems at state and local level, that when we do the research and also the surveillance, it's really important to remember that we have to really strengthen the local public health departments. That was something that really was emphasized because they've been weakened, and we really need a strong local communities to really do public health research, but also to do surveillance and to really be able to monitor things. In addition, we had recommendations with surveillance in terms of that we nominated the CDC in the recommendation 3 to convene a task force, and the CDC has already started some of this, and so we congratulate them on doing that. In addition, we really recommended thoughts about trying to collaborate with other groups such as Robert Wood Johnson Foundation to really start looking at collaborating with them. It was pointed out that we might need to think about how we present issues because they use a different terminology, different semantics. They also have different ways of assessing things that your typical eye care provider, eye care researcher has. And so to really start looking a cross-cutting way of doing that. And in doing that, one of the things was recommended that we really not just stay focused on vision, but that we also kind of join forces with hearing and others who are looking at sensory disabilities and sensory losses. That a lot of times when we're thinking about maybe incorporating vision components into NHANES, which is something that the CDC would like to do, maybe not just looking at incorporating vision, but maybe incorporating something about all of the senses so that we can get the vision component in there, but we also are strengthening our base and our advocacy by including also hearing, for example. In addition, just to reemphasize in terms of next steps, we really think that HHS needs to step up to the plate. So that was one of our calls to action, is to somehow getting them to engage. How do we do that? We're thinking about it, but we really want to, if we do get groups together and have working groups, then at least we want to have representatives from HHS there so that then we could move forward with some action items to make a difference. So.
Is there an alternative plan if you can't get their attention?
Yes, we were then going to pick on RWJ Foundation. Let's see if they, because they have a culture of health and county health rankings, and we were hoping that maybe we would have some context to help encourage them to potentially come involved. But as I had mentioned earlier, they tend to look at issues differently than eye care providers or eye researchers do. And so we really need to think outside of the box. And I think that's what we're hearing in a lot of the breakout groups and a lot of the sessions, is that we really need to stop thinking about the world from our own little teeny view of 1 inch or so. We really need to start thinking about what's out there outside of the eye care community.
I didn't see much about the NEI, the National Eye Institute, and their involvement. I mean, this is research and surveillance, so is there any role, anything, any, discussion about the role of the other federal agencies?
In our group, we didn't bring it up, but and you were in our group, Janine.
Well, actually, Dr. Coleman, there was a question that I asked earlier that wasn't answered about the opportunity to get perhaps some additional funding for National Eye Institute to do T4 research and community-based participatory research, and perhaps that could be something that could be added. I mean, there's also the National Center for Minority Health and Health Disparities. There's HRSA, there's PCORI. There are a number of opportunities, I think.
Right. Well, good.
What do you think?
No, I agree with that. I mean, I think that, as a committee, we didn't call out the National Eye Institute, and yet we did call out the CDC. And I think, I think that they are responsible for eye and vision research. And so I do think they have a responsibility to this country for doing that. So I think it is appropriate to look into mechanisms for having them also step up to the plate like HHS, since CDC is doing their job.
Yes.
I'd just add that to that, because I did bring up NEI in the session, just from under the context of the fact that we need to make sure that these agencies, NEI, CDC, HRSA, and others, are communicating and working together. So I wouldn't put the onus solely on CDC or NEI, but they tend to operate in silos, and if there's any way we can work to break those down, that would be terrific, while encouraging NEI to step up and do a little more of this research.
I would also add the Office of Women's Health, since we have Dr. Janine Clayton there too, who's an ophthalmologist.
Well, I think that's one reason why the committee called out on HHS, because they were looking for an overarching group. I mean, because who is the overarching group that's going to help pull together these different organizations that all have different benchmarks that I have to make, and working together I don't think has been one of them. And so that might be one of the first things we try to do, is to get that where it's encouraged that they work together, so that then that gives them opportunities. Thanks.
Excellent report.